Good morning, everyone. I'm feeling re-energized because someone at Express Scripts, I think, managed to get us blocked for one day because we used misinformation. But whatever.
We're learning, just like you guys.
We're not learning. We are like... Express Scripts can do whatever the hell they want. They can deny patients, delay patients.
Write nasty things.
And the people doing the work get in trouble. Whatever.
Typical.
Classic. So, we are still riding high off the Mark Cuban tweet. I talked to my patient yesterday. Nothing has happened. No movement forward. How classic is that?
We had our podcast yesterday, and it was wild to hear that he was getting charged from Anthem $400 a month for 4 years.
Yeah, that's one of our patients that actually did a complaint against United Healthcare and Anthem, and he's such a genuine person. He's 70 years old. He's like completely in financial stress because of United Healthcare and Anthem pointing at each other. So one crisis at a time. We've got the United Healthcare stuff, the bills squared away, that they're rebilling it, and now I'm coming for Anthem because they need to refund his premiums that they took from him unknowingly to him. He and his wife didn't sign up for that.
Which is, so like with our insurance, if I was married and I wanted my husband to get on our insurance, I would have to sign something, right?
You would have to sign something, and you would also have to pay for it. So there is a little bit of unknown because the wife did have a payroll deduction, but you never know what Anthem's doing and how she worked at Anthem. She retired from Anthem.
Oh my gosh, I thought it was the hospital.
No. She worked at Anthem as a case manager.
Oh my God.
This is how insurance companies treat
their
own
people.
Yeah.
Love that.
They siphon direct patient healthcare dollars away from the physicians. What are you snapping for?
Whenever they send the snap, I snap.
Oh, I can't really snap.
Or whistle.
I can't whistle either. That's correct.
I can. Those are two things I'm better at you than.
Yeah, well, you know what?
I'm going to start... Can you whistle?
No, I can't. And I'm going to tell you straight up, I can't whistle. And I actually don't really care about a whistle because I have a whistle and I will blow it.
In first grade, I could whistle even with a missing tooth. Ah!
Hi, thank you for the... Is that a hot dog with an apple? I love a hot dog. Okay, so...
You know where you need to get a hot dog from?
Where?
Five Guys.
I'm not getting a hot dog from Five Guys.
It was the best hot dog I've ever had in my life.
Okay, well... Listen,
let
me tell you why I can't have a hot dog. Because my family used to make hot dog soup. I grew up in a very poor family, and with that disgusting white foam on the top, I was like, I do like a hot dog. Dr. Bach and I lived in Chicago for 2 years, and so we got some good Chicago dogs off the street, the carts. But my hot dog go-to here in St. Louis is some little hole-in-the-wall place at 141 and Olive. It's called Red Hots.
I think it was Chuck that commented it, or I have the user numbers mixed up, and he was like, one day, Claudia, we're going to go to Sonic.
Chuck's not taking you to Sonic. That's not happening.
Are you the CEOs? I am the C of nothing.
I am the C of nothing either. I am the bathroom monitor and the practice manager.
Miscellaneous you.
And so I will, and I also am channeling my inner Spider-Man today. So here, like, zzz. And what I'm doing is I'm casting a web, and
Claudia is the CEO of my heart.
Oh boy. I'm not a CEO. I am a bathroom monitor and a practice manager, and that's what I'm trying to do is just get a pathway to care for my patients.
And teach people how to advocate. Don't give yourself.
Well, okay, and I'm just,
She's a teacher, and when the student is ready, the teacher appears.
I have been trying to teach this one all day long. For years, but she's actually done amazing work here, and I need to give a shout out to our little Claudia because she has 21,000 people now.
Multi-pass said 20K now. Claudia famous.
Yes, Claudia is famous, and she's going to go to the NORM conference this year. That's National Organization of Rheumatology Management, and she is going to be helping Wendell Potter, who we both have fangirl business crushes on.
Thank you, babe.
He's 74.
He's so kind, though.
Oh my God, he's just such a good soul. At any rate, he's going to be speaking at NORM, and she is going to help Wendell with his social media. So Wendell's a big deal,
He is.
and he was in our clinic in June, and we're working closely with him on some things. Oh, I've got my rings on wrong. First world problem, right? Okay,
Let me take one of those for you.
absolutely not.
What size ring do you wear?
I don't know. No one cares.
Mine are smaller than a 6.
Well, I don't
So
care.
if I ever get married,
I
they're gonna
have
have to
been
get K
married
jewelry.
one time, and this is my 3rd wedding ring because I want, and they've all gotten smaller each time.
Your finger's gonna be stacked to the
No,
top.
I trade them in because I want something I can put rubber gloves on with while I'm working because I am a bathroom monitor, and sometimes
Office address
get-
to send flowers.
you don't need to send flowers. We have flowers, but you could Google us. We're at drbach.com. All right, so wait a minute. Let's just back up a step and say what we've got going on here.
We're gonna do a You Paid For It series. We're gonna start recording more phone calls where I'm the nice cop, she's the mean cop, and we're also gonna be doing a what to do with a denial.
Right. So I would like to have. I wanna follow this Quest mess until it's over, and Dustin, you need to call me. Look, close the door. We're calling him again. He didn't take my call this morning, and now we're going to call him again.
Call the wife, grab your coffee.
Don't spill your coffee on me. Okay, let's see if we can get him on the phone. I literally would like. I feel like channeling.
He's like, call me anytime.
Yeah. I feel like I was channeling my inner Howard Stern.
Julie with the heart hands and said,
Yeah.
oh, you're like, I see it with my glasses.
Okay. Yeah, I can.
Loved the Quest video. Thank you.
The Quest video was a winner, and that was her idea, and she's making it go crazy.
600,000.
Okay, 600,000 views on one Quest video.
Is that like
Do you
the size
understand
of
that
a
this
football
Quest guy
stadium?
told me I could call him anytime?
He said call before posting on social.
I'm sorry, I missed your call. Please leave me your
We're
name and
definitely
number,
about to
and
get a
I'll get
cease.
back to you as soon as possible. If you need
They're like,
immediate
don't
assistance,
communicate with them at
dial
all.
Customer service at 866.
Julie, yay!
Dial customer
Have a
service
great day.
in hell. Okay, here we go. Ready?
At the tone, please record your message.
Oh my God.
When you've finished recording, you may hang up or press 1 for more options.
Hey Dustin, good morning. Julie Bach here, Arthritis Center. I was hoping you would take my call. You told me I could call you anytime and call you before going on TikTok, but you're not calling me back. I need to get this issue resolved. Please call me back. You've got my number. Call me, text me, send me a carrier pigeon. Bye.
Pony Express.
Okay. Second call this morning. Why don't people call doctor's offices back? Do you understand that, like,
People think the provider's line is like some quick access, and it's like, no, they're not answering
the
it.
provider's line, the physician line is even worse than the member line, okay? So,
There was one patient, I was like, listen, I really, truly, I do care, but I'm not calling United Healthcare.
okay, well, we will. We will.
No,
call
it was a
healthcare.
patient that was mad about some medication that we don't really fight about. Claudia, you are true. Thank you.
What? Tell well, I guess everybody else
Claudia,
can
you're
read.
truly stunning just sitting there in the back.
Okay, well, you know what? She is, oh my God. Okay, so last night, let's see, what time was that? I said to my contact at 4:30 yesterday, I emailed my CVS contact. I said, hey Jill, does anyone at CVS want to assist this patient, or should I have the patient file a grievance attached? She's like, oh, it's this morning at 8:16. Julie, I'm out of the office today, and I'll see if I can direct this to the appropriate team when I return. When's that gonna be?
Never.
This is how PBMs operate. Okay, you know what I'm gonna do? I'm sending this to Karen Lynch. Do you understand that Karen Lynch just got promoted? Instead of just being the president of CVS, she's now the president of Aetna because things are in the toilet again. All right. How do we get this? Let's see. How do we find Quest? No, not Quest. Okay. Oh my God. Understand this. I try to use the normal channels, and when a case comes to me, it is completely off the rails, and I still reach out to these people at CVS, Aetna, United Healthcare, Quest, Express Scripts, wherever.
Well, usually I do before it gets handed to you.
By the time it comes to me, things are beyond in a ditch.
Exhausted.
And
Exhausted.
then you have these people like CVS Caremark saying, yeah, I'm busy, off, and I'm gonna get it to someone that I can try to find
Did you see all the executive emails posted in the Medical Billers Facebook group?
No,
I'll
you
have
need
to
to
look
run
at
down
it.
that rabbit hole.
Oh, I'm in so many Facebook groups for
gosh.
patient care.
Okay, so all right, so I think
As a
that-
patient, I appreciate your advocacy. I've always had to fight for myself and feel crazy. We'll
Well-
be crazy for you.
we are here to be crazy. We are here. Okay, so I'm gonna find this email that I sent to my local yokel
Thank you.
CVS person. Her name is Jill. She does usually email me back, but it's always garbage. And I also got a couple of emails yesterday from this is amazing. Okay, I have a local yokel Anthem person. Okay, and I email her before I go. What shall we say? TikToking or social media, and I emailed her last week about a Blue Cross Blue Shield of Michigan case. And it was a Blue Cross Blue Shield of Alabama case. 5 days later, she emails me back and she's like, yeah, I can't find anybody on the inside at Blue Cross Blue Shield of Alabama to deal with this. And I emailed her back and said, oh, thank you for the email, but I tweeted it out and it got overturned in 2 hours.
You're a good leader. It's hopeful to see a boss taking care of her people.
Listen, the people doing the work are the people doing the work. And if you don't care for the people doing the work,
Yes, I'd love to work with them. Sorry, it goes fast.
it's
so I
all
have to
go.
read it.
It's all good. I mean, look, we're all people doing the work. And if we don't support the people doing the work, we won't have any people doing the work. And I think that's what you've kind of seen in healthcare is, I have 24 people to support one physician, one rheumatologist. Why is that? That's because of the administrative burdens of the pharmacy benefit managers and the insurance company. Trust and believe.
She's not a Capricorn. They called you Edna.
What's an Edna?
Edna from the Incredibles.
I don't even know that.
Where
I don't
she
even know
made-
the Incredibles.
You've never seen the Incredibles?
I'm 59 years old. I'm not watching cartoons.
I'll show you. It's a cute one.
Whatever. I'm not a cartoon person. Okay. So anyway, let's go back to my Anthem case. Anthem, Blue Cross Blue Shield of Alabama. 5 days later, my local yokel Anthem person emails me going, I can't find anybody on the inside. Why don't you just call the 800 number on the back of the card? I'm like, I'm not looking to call India. And I said, and furthermore, thanks for your email, but the case overturned in 2 hours when I tweeted it out. And then I emailed her a picture of my social media is the new prior authorization talk.
I'm a Capricorn. She's a Pisces.
I'm a Pisces, but I don't believe in any of that stuff.
That's true, though.
Okay, well, I don't care. Oh, I have a Crentist appointment. Okay. I'm back in
Thank you,
braces.
Lyndon.
This is, I think this is week
3.
4. Week 4 or 5. I don't even know. All right, what other questions can we answer for people today?
We just have a lot.
All right, so I am still, who's on my,
Love the B for broomstick initial magical.
one of my staff gave me a t-shirt that said Arthritis Center, and it has a picture of a broom. I need to wear that in here, but I'm not really a t-shirt person, but I will bring it in and wear it. And it says Julie B as in broomstick, and it has a picture of a broomstick. Listen, I have had people overseas, offshore agents, ask me how to spell bathroom monitor. Okay, what? You know why? Because they don't know what it is.
Well, and then you have to spell it with like B as in boy, A as in apple, T as in Tom.
Right. But the reality is this is my house and I am the bathroom monitor. My desk is like 6 feet from the patient bathroom door. So it is my responsibility. And I actually have a junior assistant bathroom monitor trainee who happens to be my charge nurse.
I was like, it's not
Her name
me.
is Tona. No, you can't be in charge of cleaning messes.
No,
You're either
I accept
cleaning
that.
messes or you create a mess.
I create.
You
those.
create messes, but the thing is, you create good messes on
And bad.
TikTok. You create good messes on social media. That is your superpower.
Yep. I'm
create
really
a
good at
mess.
rattling the.
Yeah. So, okay, they're outsourcing way too much. You got that. I want to. Let me see.
That was a good read. I missed that.
What?
They're outsourcing too much. Speaking with
Yeah.
non-native speakers of English can be frustrating, and outsourcing is troublesome.
It is troublesome.
Well, they're getting paid like 75 cents an hour.
Yeah. Okay. So can we just highlight something that happened that is like my Super Bowl? I keep having Super Bowls, and I'm actually potentially having another Super Bowl situation on Friday at 1:00. But I'm going to be doing that from my house because I need everything to be quiet. And I don't want the dog or Dr. Bach, actually, or you bothering me. when I'm talking on this call.
Oh, cool. Even though it's for social media. Mean.
What? It's not for social media.
It's not the thing with wars?
Yes, but that's not for social media.
What is it?
It's not for
What would
social
you
media.
consider it?
I consider it a coup. I consider it
Where's it going to be posted?
Well, I don't know. That's
Social media?
No, we're not. It's not there yet. We're talking. You know how you're talking to all these moronic guys? I'm talking with this big wig with my friend Morris. So I can't have any problems.
That's fine, guys. Well,
You-
I've got you.
Okay.
We've got this.
You don't even work on Fridays in the office.
You don't either.
I do too.
You worked one Friday.
I'm working this Friday too because Nick's still gone. He's still on vacation.
Maybe
Dr.
I
Bach
am.
will be here. Okay, so I just want to go
And your
over.
Super
Is
Bowl
this
era.
is this on the thing that they can see it? What is that called?
Mirror.
Okay. So this is the Arthritis Center Twitter. This is Mark Cuban. Okay, Mark Cuban has 8.8 million followers, and Mark Cuban took pity on me. Maybe, I don't know. And he
I love your little playful arguments on the side. They're not playful.
tweeted out one of our patient cases because Mark Cuban is a humanitarian, and Mark Cuban gives a rat's behind about little people like me, like her, and our patients.
Me and Mark email.
Mark and I. All right. So because of that, we've gotten 61 reposts, 355 likes, and here's the biggest thing for me: 244,000 views. Okay, so when that kind of traction happens, that's the power of social media, because there's two things that I know for sure. Everyone's a patient, and every single person has been denied or delayed care by an insurance company.
And a lot of people don't know why or
I don't-
what's going on.
Well, because, the Express Scripts is doing the wrong thing. That's the bottom line. When people do the wrong thing, we have to ask for help from those that can help us. Mark Cuban can help us. And I thank him for being so gracious to pay attention and take a minute or 10 minutes or whatever it was out of his Saturday to help us. It's my new pinned tweet on Twitter because I'm a fangirl. Are you about to cry?
And no, I was laughing because someone said, I love Claudia, winks at Mark Cuban.
What does that mean?
I winked at Mark Cuban. Which PBM does he use for his companies?
He has his own. Mark Cuban has been like amazing.
Thank you for doing that. Insurance companies acting so entitled to undermine physicians.
all day long.
I saw it mentioned on LinkedIn.
Okay.
Mark Cuban
Yeah.
is owned by a PBM.
No, Mark Cuban started his own pharmacy, Cost Plus Drugs, and Mark Cuban is doing the right thing. And in fact, I love that Mark Cuban, he is put out there publicly that self-funded employers, which is typically somebody that employs more than 100 people, their CFO, their chief financial officers, they will be sued. It's only a matter of time if they have a contractual relationship with one of the big PBMs. That would be Express Scripts, OptumRx, and CVS Caremark.
That's who they were blaming for all the fiduciary responsibilities not being upheld.
Well, right, but the PBMs are very, very crafty. Some would say marginal. Some would say they're liar, liar, pants on fire. That would be me, because they have a duty to. If they're making a contractual relationship with a self-funded employer, let's just pull one out of a hat. PepsiCo. I happen to know they're with United Health Cartel, and I also happen to know that PepsiCo mandates to OptumRx. So when I have a patient that works at PepsiCo, I need to, when they're an infusion patient, I have to get an override to care for them in my low-cost center, as opposed to PepsiCo paying 2 to 10 times more for the drug on the white bag side. I have a pathway to do that just because I've spent 100 hours on the first case, but now I have multiple PepsiCo patients that I can follow that same pathway. But what happens is you need to, the CFO of PepsiCo either doesn't know that he or she has signed up with a deal with the devil that mandates to white bag drug, or they're on the take with the PBMs. It's one of those two. It's not anything but that, because they're either getting something on the side, vacation home, I don't know, Starbucks card. It could be anything, because these are multi-million-dollar deals that are happening in the back rooms of a pharmacy
Taylor
benefit
Swift
manager.
tickets.
Taylor Swift tickets. I bet that PBMs can make that happen.
Yeah.
So,
I mean, if a PBM wants to sell me or give me some tickets, I won't talk about you on TikTok for one day.
no.
Do you think they don't know? I think they do.
They don't know? Oh my God, they totally, the CFOs? I think some of them literally don't know, because every time I have written and gotten a direct contract to bypass the PBMs, and I'm talking Edward Jones, Boeing, none of these people are aware of what was going on. So how can these giant companies not know what's going on? Healthcare is like a huge expense for these people, and the drug spend, the specialty drug spend, the place where I work in, because I'm a rheumatology office, that is like a line item. That's like typically more than 60 or 70% of their healthcare dollars being siphoned off the top to a pharmacy benefit manager. So
They're all out on the course working on their short game.
yeah,
I say that.
yes.
When Alexander Bell invented the telephone, he realized he missed 3 calls for Mark Cuban.
Yes, well, could be. So yeah, so how the hierarchy works is that if you have to, pharmacy benefit managers like Express Scripts, Optum, and CVS Caremark, if you have to have your prescriptions mandated to you, mandated means no one has a choice. Your patients, your employees can't shop for a prescription. If they have to be mandated, there's something sinister going on in the back room, because then all of these prescriptions are going to one entity and they don't have to perform. That means they don't have to take my phone calls. They don't have to take your phone calls, and by God, they don't. All right? Trust that these people are doing the wrong thing. All you have to do is look at the profits, the multi-million-dollar profits every quarter from Optum, CVS Caremark, and Express Scripts, and you will see healthcare dollars siphoned away from direct patient care to middlemen that literally are unneeded in the industry.
Yeah,
That's my soapbox today.
that makes sense. That's what someone said.
Yeah, so that's what's happening in my world. Anything else you want to talk about today?
We'll be back.
We will be back. We'll be back.
Bach. Dun, dun. Oh, 42 are still on though.
Okay, well,
Let me see. 99% better.
okay.
I guess you could just do stuff.
All right, well, let's do stuff. Let's do stuff.
Do you need
Okay.
a Pepsi or not? A
No, I have new braces in today, and I'm not doing that.
Do you need water?
Okay. Matt Tennis. Okay. All right. Okay. I just got a concerning text. It makes me stop and say, all right, so I need to figure out what we're doing here. Yeah. That one is that. All right, I need to have a phone call with my friend. And see what we're doing. I think it's Quest. Dr. Bach's office, this is Julie. Hey, what's going on? Okay, wait, hold on. What, I missed that?
I said I was on a call earlier and I just couldn't click over.
Okay, oh, awesome. All right.
Ignore any, I promise.
That's all right. You know, I hate to be ignored. It's my, it's my whole thing. Okay, so, have you resolved what's going on with this patient thing?
So I'm still waiting on one person from billing to get back to me. So
Okay,
I think it's
This
to
is
me it looks
Quest.
like there's confusion. So the testing from 3-4 has already been credited, so there's no balance on that. The balance is from 328. So I'm looking at this, and to me it looks. Did the patient not have insurance?
No, they have insurance.
no, the patient has insurance. Like, this is the whole craziness of it all. The patient, like, I mean, I would honestly prefer to just have him do his labs here, because then I don't have to have 1,000 phone calls about it. But I don't know if he wants to go to Quest or he's mandated to go to Quest. But but nonetheless, we have to just figure it out.
So there's no insurance on the date of service, and that's why they're charging him list price. So we just need to get insurance added to that claim. from what I can see right now, like I said, I'm waiting on somebody from billing to get back to me.
Okay, so let
But
me
from
do
what I can
this.
see,
Okay, Claudia, go pull up that patient and figure out if he's had an insurance change. Did you guys try to run the insurance that you did in March for April?
I can't see that. I don't know. I can talk to the billing guy.
Okay,
I'm assuming it's the same insurance.
I'm assuming it's the same insurance too. And
Okay.
so it doesn't make sense to me so are you saying that Quest drew the wrong lab or they didn't draw the wrong lab?
No, the labs are correct.
Okay,
The labs are correct. I pulled the two orders that I had from the 4th and the 28th. The orders are correct. Everything on there was correct. The only issue I see is that we don't have insurance. So it's charging him list price. And nobody pays list price. That's astronomical.
right. Okay, well, this is your cell phone, right?
Yes, this is my
Okay,
cell phone.
I'm gonna figure out the insurance and I'm gonna text it to you and say it's the same or it's different, but my guess is it's the same insurance. And I don't know if it's possible that anyone in Quest leadership could figure out why you would have an agent that would be so aggressive with my staff and my office, because that is not cool, you know?
Yeah.
So,
Agreed.
okay,
Agreed.
all right. I will text you and let you know if the insurance is the same or different, but I think if you just run the insurance that you ran in March, I think this resolves.
Okay. And I'm not on that side of it. I'm not sure if I need a new copy of the insurance card since it's not on this particular order. So if you can, if it's this either way, if it's the same or if it's different, if you can just send me a copy of the insurance card just front and back,
Yeah.
and then I will forward it to billing and get that added, and we can go from there.
Okay, awesome.
But I think that, to me, that looks like the issue. I mean, that looks like
Okay.
the primary issue.
But you don't think that you guys don't capture and keep those insurance cards on file?
We do. But what I'm saying is I don't know the billing policy as far as, since it's not on here, since it wasn't submitted with the claim, we can't assume that it was the same, I believe.
Okay, well, that really doesn't make sense. But nonetheless, let me figure it out and I will text you either the insurance card or I'll text you that it's the same, okay?
Okay.
Thank
Nick,
you.
what was that TikTok thing again? I was going to show it to my boss.
The TikTok thing is C_money 636. So, yeah, it's only got 600,000 views, so.
Right? That's kind of unbelievable. That's crazy.
Right, 600,000
So-
views in 8 days. So, yeah, C_money 636, okay?
Okay.
All right.
Okay.
Thanks
Thank
for the
you.
call.
And yeah, of course, as soon as I get that, I'll get this resubmitted and I'll be in touch.
Thank you.
You're welcome.
Bye. And there you have it. Quest now has decided that they're going to play ball with us. Now they're billing a patient list price because they don't think he has insurance. Guess what? He does. All right. I am going to go figure this out. And Claudia?
You haven't received any communication. Have you, so has your insurance changed or anything? And you gave them your insurance, right? You've had the same insurance, right? Oh my Lanta. So we just got off the phone with the Quest guy came in yesterday, surprisingly, and we made a TikTok about the situation. If you want to see it, it's kind of hilarious. My TikTok is C_money, MONEY 636. Don't judge me. It was my 8th grade handle for Twitter. And it's gotten over 600,000 views. And the Quest rep was like, reach out to us next time. And he just called us and he's like, the only difference is that they billed him for not having insurance. And I was like, yeah.
How are you?
And that's what Julie was telling him. Julie's like, no, there hasn't been a change in insurance. They wrote off the first set of labs for you. And then the guy said he was trying to see he wanted me to see if you had changed insurances, which I'd stated you had not. So we're trying to get this whole thing kind of like written off for you so you don't have to deal with it. $3,000 is out of this world. Like if I just had $3,000 to spend for labs, I would not be here. Right, and that's what I was explaining to him, because they even sent us like this letter wanting us to sign it in order for like the labs to, I don't know, it was a weird form, and he even goes, that's not right. And I was like, exactly. So I will keep you updated with everything going on. No problem, that's what we're here for, and just let me know if you need anything, okay? My name's Claudia. Cool, follow me. All right. No problem. You too. Bye. Good morning. That was so cute. Thanks. What you want? Baby, I got it.
We do work here, huh?
You do work?
You do work here.
Yeah, usually just the silly things.
Counting patients down.
Well, that patient, we're actually kind of going viral on Quest about it because Quest was trying to charge him like $3,000 for a lab when he had insurance and they messed up. And I was talking to a representative and I go, can I have your first and last name? And she said it was Idaho. And I go, oh, like I don't do nothing. And then she needed to speak to Julie because she didn't like that. And then Julie got on and Julie said, if you think Claudia had a bad attitude, you're gonna love me.
It's really just a tone problem, so.
Wow.
Hey, I say that around Christmas. Let's go find the boss lady. Hi, James.
Claudia, come here.
Okay.
Can you usually hear your heartbeat and your blood pressure?
What do you mean? Yeah?
Yeah.
Do you want to do mine?
Yeah.
And this is training. Mine's weird though, so if you don't think it makes sense, it probably does.
Okay. Mine's just hard to see.
If I lose an arm, Kristen, I'm coming for you. Look how cute she is. Right? She's gonna be raising blood pressure just like that one.
Stop it.
You look cute. I saw your TikTok the other day. I was like, weird. She never wants to do one with me.
Which one?
The one where you were mouthing some country song.
Oh, I'm sure. Let's see.
So one thing that I do, it's just a little tip. Whenever I place it, I kind of like do that, and then you can kind of feel the pulse too.
Like put it down. Don't put your fingers up there because then you'll listen to your own heartbeat.
Right. Here, you can. Don't be scared to touch me. Like,
There you
yeah,
go.
just.
Okay.
Did you? I used to always do it without closing my ear thing.
I still do that.
And then you want me to rest my arm.
Victoria, just have a seat here. Kristen has somebody in there right now, but she'll get you whenever she's done. Do you want something to drink? Okay.
Hey!
I absolutely could not see it.
Okay, let me try your heels. I love your tattoos.
Thank you. I have 6.
I have too many. I'm giving you a hug in 1 second. So Meredith, sit down. Can I borrow this?
Mm-hmm.
So.
Hello, Meredith. Do you have a preference on which arm?
No.
Cool.
I can act like pretty sure it's real. So.
I can act like a real medical assistant and break your arm.
Ain't no way that's not side enough.
What?
It's not on side enough.
Trust me. Oh my god. Well, then sometimes I would get nervous if the arms were like really big. And I'm like, oh, is it gonna fit? But it did always. Move your arm down. It'll be fine.
No.
What? Do you have tiny arms?
No, I have man arms.
No, you don't. You're too
Cute. There you go, princess.
And if you ever run into an awkward situation with a patient, just like play it off. Be like, ha 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 ha. So. I heard that. No, I love her. No, she got me my vinyl player, and every time I buy a vinyl, I think of her. So do you see how my hand's kind of holding her?
Damn.
I'm 18/76.
So I
Another thing you can kind of see it jump if you can't hear the heartbeat.
You're more likely to see it jump than hear the heartbeat, to be honest.
Yeah, I always go for the jump.
You see it a little bit better?
Yeah, I did.
Okay.
Oh,
You want to try again?
You look so good.
I don't want to break your arm off.
We can use the other
How
one.
are you?
We're so on
Thank you
live right
so
now.
much. I haven't seen today, the sun today, ever. I don't feel like I do not get infusions anymore. Where was every 2 months?
Is that good?
Oh.
Is it loose?
I'm good with my life. God, the vinyl player is my life. It's my whole vibe. It's my life. And I think I've had it like 2 years almost.
I can't get mine to sync up to my little wireless speakers up, and I think my receiver's too old.
What? I'll have to look. I'll get you one.
I can get it, put it to my bucket.
I just,
In fact, I brought my big original Sansui floor speaker things out of the basement finally, and I'm like, I've moved these things seriously 13 times.
that's
And it's
amazing.
now that I wanna bring them out, one of the frames
And you're like,
got cracked, but it's like I can get.
Am I not running enough air?
I've got who-
I think you were running it
Yeah,
a
I was
little too
stressed, but
slowly.
I'm using them
Okay.
now as my TV base because I didn't have anything to produce.
I always know
And like go down the
I'm
basement.
gonna probably break my arm off it. That's okay.
well, I didn't even know they could like make fake vinyls. Really?
I think that's why I can't see it, 'cause I'm not
What is it called? Like pirate? When they pirate it?
Oh, okay.
So I went to a record store
So
and
you
they were
can
like,
kind
be
of hear
careful, you
it
gotta
coming
look
out.
through to make sure it's not a fake one. But my
you see
vinyl
it?
player is
Did you see it?
Yeah.
live.
It's good. Hey, it's fun, my face.
Yeah?
Yeah, they're broken.
Oh, how are you?
Well, now I also know that yours is usually 118.
That's not.
It's not?
It's usually pretty low.
Oh, I would get blamed for it.
Like below 110. Between 100 and 110. Over 60 something.
Kevin. Hi, Blair. I can fix it.
I'll watch some videos, I guess.
It's bigger.
It will come with time.
If you want to try that, you can, but the motor's
We need to get my own stethoscope.
We do have an extra, so if you don't want to like buy one right now, that's fine. But probably look into getting one.
Oh, yeah.
Oh my gosh.
I felt so bad. Because he came home, the guy, when I told him, I said, okay, I'll come home. That was like on a Friday, so I was up there. But then I was just, going through, keeping on Facebook things because my nephew's getting married, there's everything out there, and then I'm like, all right, well, who do I know?
You should have added me.
But, and what happened is when you gave me the card, about the, it didn't connect me to it. I thought, what am I doing wrong? And so that's why I thought, well, I'll just look up your name.
Yeah.
And that,
Just add me.
well, I don't actually know how to do it.
I'll add you.
friends. I was just doing it for Marketplace. Because I had one that I set up like, 2009 or 2010,
Right.
and then I wanted to discontinue it. Couldn't figure it out for the life of me, just stopped using it. So last year I had a bunch of garage things to get rid of, and my niece keeps telling me, oh, go on Marketplace.
Yeah.
So I set up a new account. Then all of a sudden, when I went to set up a new account, they're like, an account exists for you. Copy your driver's license, want this, that, and other to verify.
Oh my gosh,
What
stealing the
is this?
Declaration of Independence.
I guess. So now all of a sudden, the old one's back.
Well, I'm gonna keep you in my prayers. I'm so sorry for your loss.
Thank you.
But we get to join a group together. It's the Lost Parents Club.
Yeah. But my mom is good.
Good. See?
Oh,
Bunny, get out.
yeah. So I called that patient, and I was like, so you're kind of famous. And he's like, what's the username or whatever? And I go, okay, so like we videotaped the call and we posted it. It's got like 600,000 views. And I gave him the username. And I was like, did you by chance change insurance? He's like, I've worked for the same employer and have the same insurance for 4 years now. He's like, that is so sleazy. What does that mean?
What? What does it mean? It means that,
Like, is it a bad word?
yes.
Oh, I'm sorry for saying it so loud.
Yes, it's like a slut.
Okay. Julie, you want the people? Do you want to talk to him?
I can. Same insurance.
Patient's pissed.
Insurance for 4 years. Hi, everyone.
It's
So-
PepsiCo.
What's PepsiCo?
It's insurance.
Are you serious? Through United Healthcare?
No, it's yeah. Through.
Amazing. Okay, a 600,000 view video. Quest. Well, they're not mandated to Quest. Why is he going to Quest? I'm so worried you're going to dump this coffee, and it's like giving me.
Tona has taken over to coffee dumping.
No,
Ask her.
I'm not.
Ask her.
I'm not.
We had a meeting.
I'm not.
Her and I
this
met.
is not about coffee. I don't think you
It's
should.
you just brought up the coffee. This is where I get
I don't
confused.
think you should be allowed to have anything but clear liquids in the office.
I disagree.
Okay. What do you think about that?
I think
rule?
that's a hard stop because if I don't have coffee, you'll kill me.
Oh my God. Okay, so he has. Let me look at his insurance card. Oh my God.
He is.
Quantum Health. Yes.
Abbott.
Abbott. He's not PepsiCo. Abbott Labs.
Oh, I guess he used to be here.
PepsiCo. Through United Health Cartel. But that's not his current insurance,
No,
is it?
this one is.
Okay. Scroll down. Let me just take a picture of this guy's card and send it to this doofus. Okay. Camera. Here we go. Sorry. Oh, so sorry.
Oh, so sorry.
Oh, so sorry.
Oh, so sorry. Oh no, I should not do that.
What?
We gotta.
Oh my God, right?
I was gonna say 42. I don't think that's the right answer either, but that was my answer. Oh, okay.
I have no idea. North Carolina. No. Mm. Ah. I don't have a man. Mm-hmm. Doctor office. Oh, man. Sometimes I feel like it's a sign. What?
Are you working on something?
I was getting a pine ready.
Okay, we'll do that, and then I want you to get off of that, and I want you in this exam room.
That does not sound fun. It's the room of doom. Sorry, guys.